As we celebrate World Diabetes Day, I would like to draw attention to the ever-growing impact of diabetes on public health and the urgent need for it to be addressed as a priority by policymakers at national and European levels. The Diabetes Resolution adopted by the European Parliament on the occasion of World Diabetes Day 1 year ago was an encouraging step in this direction. However, much more remains to be done to reverse the rising trend in the numbers of Europeans living with diabetes and to improve their care, health outcomes and quality of life. In Europe, more than 61 million people currently live with diabetes, of whom 1/3 are undiagnosed. Diabetes is a lifelong condition, and the longer a person lives with undiagnosed diabetes, the more likely it is that they will develop severe and costly complications. Some studies have found that up to 35% of people living with type 2 diabetes, for example, already show signs of complications such as cardiovascular disease at time of diagnosis. Primordial and primary prevention, including screening and early detection, is key to turning the tide on diabetes and other NCDs. At primordial level, we need to create enabling environments that address modifiable risk factors and the social, economic and environmental determinants of health. Nowadays, poverty is one of the biggest risk factors for diabetes. Poverty by itself is associated not only with higher diabetes incidence, but also with inequalities in access to diabetes care. At the primary prevention level, targeted screening for all types of diabetes and diabetes-related complications, coupled with awareness raising, can play a significant role in the early diagnosis and reducing the disease burden. This requires strengthening primary and community services and care. Another key factor behind the rising number is the lack of policy focus on disease, with many policymakers' attention being diverted to the multitudes of crises the perma-crisis we live in. On the occasion of World Diabetes Day, I want to stress that we must do better and work to improve the lives of all citizens in Europe and reduce inequalities. That's why, as an IDF Europe Board Member, I welcome the upcoming high-level technical summit on diabetes that will take place on the 28th and 29th of November in Serbia, where, in collaboration with WHO Europe, we will seek to develop solutions adapted to the perma-crisis era to improve the detection and diagnosis of diabetes and improve care for all who need it. Together, united, let's accelerate action on diabetes.